So the knee has 4 main ligaments that kind of wrap around it. The ACL is in the front of the knee. It attaches, simply put, from the bottom of the femur to the top of the tibia. So it actually helps the tibia to not slide too far forward with action. So it can become injured when we overload it with a force greater than what it's designed to handle.
Yeah, for sure. It's a really important ligament in the knee to help with just overall knee stabilization. So our knee can do all the things that it's meant to do. We can go walk, we can run, we can jump.
Helps with rotation.
Climb. Yeah, helps with all sorts of stuff and just make sure that the knee stays stable. Yeah,
so with a contact injury, there's going to be a mechanism that forced that joint beyond its capacity. So that could be a player on a field, it could be a car accident, or just some outside force interfering with what the body's capable of, I guess.
Yeah, definitely. So like you mentioned, great examples are like if you're a soccer player and someone slide tackles you or something,
right.
Like someone is actually hitting you, it's an outside force actually having an impact on the knee, which is then causing the injury to happen.
Yeah, whereas a non-contact, it's all your own fault.
Right, yeah. So what would be a mechanism or an example of like a non-contact ACL injury?
Sure. So they're really common with deceleration, so slowing down from a sprint too quickly, landing flat-footed from a jump rather than kind of on the balls of the feet, allowing some spring in the knee. Let me think. What else is kind of like a quick pivot on the field?
Yeah, it's kind of like with your foot planted, you twist on the knee, and a lot of that rotational force actually goes into the knee rather than like your foot sliding across the grass or something like that. So That's one of the reasons why like football players and like soccer players, it's really a common injury to hurt their ACL, because with the cleats, it'll actually dig into the grass. So if there's some kind of rotational force, rather than their foot sliding across the grass like it would with normal shoes, it would actually go up into the knee.
That's what's so interesting about sport-specific injuries. There's an exact reason why there are common injuries. Just like you said, like the cleats catching in the turf. So.
Well, like another common thing that I see a lot of is like with skiers, because you have your big boots on, right? And those boots aren't going to let your ankle move around a whole lot.
Sure.
So if your ski gets turned funny or something like that, rather than like your ankle being able to take some of that force, and just travels straight up into the knee because your knee's not in any kind of a boot or anything like that, right?
Yeah.
So, but yeah, it can be a little bit more sport specific. But yeah, there's all sorts of different ways that you can hurt your ACL, right? So, but yeah, like one example, I was talking to a guy last night actually. He had just come off ACL surgery. I think it was like 3 or 4 months ago. But yeah, the exact mechanism of injury for him was he was out playing soccer, had actually tried to stop with his leg that he ended up tearing it in, and he kind of sort of slipped, but then his foot caught, so his body went kind of over the top of his body, kind of almost like hyperextended his knee, and that's what actually ended up tearing it. So,
ouch.
But yeah, there's like all sorts of fun ways, right, with quotation marks.
We're doing air quotes.
Yeah. Fun ways of getting it hurt, so.
Sure. So females are actually more likely to have that injury happen to them for a couple of reasons. One is the notch that the ligament sits in the bone of the femur is actually smaller, so there's not as much protection there. The other reason being that women typically have wider hips, and that affects something that we call the Q angle. Essentially what that means is the wider the hips are, the wider the femur sits, and the more narrow they have to travel down to the knee. They become more narrow. So it puts the knee joint at risk as it articulates for injury.
So like with the Q angle, right? So if your hips are wider and your femur's coming in more narrow, so your knees are more closer together, right? So that puts you more prone to when you're like jumping, or even like landing from jumping, or when you're running even, or when you're stopping for like a pivot or something like that. It actually makes your knees more prone to continually come together. So yeah, when they're actually doing that movement, their knees are more likely, it's like that knock knee, right?
Right.
Knock knees. It's that type of a movement of their knees in towards each other, which increases that Q angle, which puts a more stress on the knee itself, which is thereby going to put more stress on the ligaments itself.
Sure.
Which then puts more of a likely cause of injury to the ACL.
Yes.
Yeah. So,
Females also have a bit more range of motion too. They're in the hips, and the ligaments tend to be a little bit more flexible than in males.
Yeah, for sure. And sometimes people think like, oh, like we always want more mobility, right? But sometimes that actually can be a problem, because you can start to lose stability, which starts to put you at greater risk for injury.
Right.
Yeah, definitely. So we talked about some examples of how that can come into play. So like you mentioned a little bit, like, so for female athletes, like when they're jumping, when they come down and land, if their knees are coming together a little bit more, it puts them at greater risk. But just in general, like even not even thinking about females, like if you're jumping and you're coming down and you're landing with like flat feet, that can actually cause your knees to collapse inward, causing that same kind of effect that puts you at greater risk for ACL injury. So that applies to both females and males. It's not just necessarily female specific. Females are just more prone to that due to the structures, but those kind of mechanisms are really things that everybody should be aware of and should work on.
Landing with locked knees, that inhibits your knee joints from helping to absorb that force. So
yeah, definitely.
Put them at a disadvantage.
Exactly, yeah. So there's a lot of things that go into it outside of just being female versus male. There's just a lot of technique and form and mechanical things that go into it. So
yeah, so going back to stability, that's very important. Women tend to have less muscle density around the knee than men as well. So really strengthening the muscle tissue around the knee joint, keeping it strong over time is really important for women. Let me think. What else?
I think a big thing that I've seen is like, so we talk about like the knee itself.
Yeah.
Making sure those things are, the muscles that act at the knee are strong and help with the stability of the knee. But like we mentioned, like the hips play into the knee quite a bit.
So like proper form and. Yeah,
making sure your hips are working with your knees correctly and making sure you have proper hip strength.
Yeah.
So, because part of what can cause those knees to come in towards each other is if you actually have poor strength in the hips and poor stability at the hips. So if you work on especially lateral hip strength, so the muscles on the outsides of your hips, those are great muscles to work out and make sure are strong as well, so they can kind of keep your knees not pulled out. You don't want your knees tracking out, outwards. So you're going the opposite way, but keeping them pulled out in the sense that you're keeping your knees in alignment with your feet and your hips as you're doing like a squat pattern or while you're jumping, keeping that nice and straight, correct form.
Yes.
Right? So
we look for muscle imbalances a lot, meaning if the if the muscles on the inside of the leg are tight, the muscles on the outside of the hips are weak, that's going to contribute to knees collapsing forward. So that's another thing people can do also is train, think of the body in a 360-degree form. So keeping quads and hamstrings, inner and outer legs trained equally. So you're not overtraining, say, just the quads and putting yourself at risk for injury.
Yeah, which is really like easy for people to do, right? You talk about like the mirror muscles, all the muscles you can see in the mirror, right? So like your quads are in the front. You can see them in the mirror. So people want to get them nice and strong and big because they can flex in the mirror, right? Whatever. But you kind of typically will forget about the ones in the back that you can't necessarily see, but are super important to keep in balance with strength. So you're having proper mechanics and stability, and you're not overdoing one side and neglecting the other, right? Yeah. So I'm glad you brought that up, because oftentimes, like we mentioned before, if one area is overly tight, usually means there's weakness somewhere else and vice versa. So you kind of have to look on both sides of the coin, if you will, to find the whole picture and to figure that out. So